I'm Judge Penny Wolfgang, and welcome to The Big Picture. The problem of pain medication and its abuse is becoming epidemic in Western New York. What is being done to help? We will find out. Then, where do service dogs get trained to help our vets or others who need comfort? I'll take you to a new facility that does just that, right here, right now, on The Big Picture. Hello, everyone, and welcome to the program. Here is a startling statistic. According to the National Institute of Health, 75% of those struggling with substance use disorder began their addiction with a prescribed pain medication. There is a new public service announcement that has been produced, which was going to air on this station and others in Western New York to help prevent misuse. Let's take a look at it.
Hi, my name is Alex. I was prescribed opiates after a football injury. I really had no idea of the true danger of addiction, and that's definitely something I wish I would have known about before taking that first pill.
To prevent substance misuse, know the facts, do your research, and ask questions.
Talk to your doctor. Be sure to ask, how do I know if I'm at risk for developing a problem? And what are signs that I should look for that I am developing a problem? I should come see you sooner. Know that there's help out there and it works.
Please remember, safe use, safe storage, safe disposal.
Joining us to talk about this effort is Dawn Sagerman from the Western New York Prevention Resource Center and Kate Chudoba from the Western New York United Erie County Opiate Task Force, of which I am honored to be a member. Thank you, ladies, for joining us. So, Kate, is the problem of abusing pain medication reaching an epidemic level in Western New York, and what kinds of drugs are being abused?
Sure. So we are at the epidemic level and actually have been since 2016. We made great strides in reducing the number of overdose deaths over the past couple of years, but since COVID, we've really hit a new all-time high. So people are really abusing oxycodone, fentanyl, and other illicit drugs.
You answered part of a question that I was going to ask you already, but that's good, about whether the pandemic affected adversely, obviously, the abuse.
I believe it did, and I think numbers are showing it. Unintended consequences from the pandemic was people were, they were sheltered, they were segregated, they were stuck in their houses, they were alone, and so substance use of all skyrocketed throughout the pandemic. Alcohol use, smoking, marijuana, they all, kind of took off. So it was an unintended consequence.
As well as opiate and prescription drugs and what we're talking about. So Dawn, this was so fabulously interesting, this PSA, or I've watched it several times, and the video, it's showing a real person, a prominent athlete who was a former UB Bull member, I guess. Could you tell us about him?
He shares some of his story in the PSA. He had a sports injury and was prescribed a pain medication, and he became addicted to that pain medication. And he is now 6 years in recovery. But he, wanted to share that with others, that something as simple as you expect your doctor to prescribe something for you that you need and that won't be necessarily harmful, and not necessarily so with some of these pain medications.
Now, the medical community is very involved in this because I think it's difficult for them to navigate the issue of helping people who have real pain to deal with pain, and knowing what medications they could give them and what might result in addiction, and if not giving this medication, are there alternatives? And this is probably a big issue with the medical community.
It definitely is. We have also been working directly with the medical community, so that if you look at the prescribed number of opioids, it's actually decreasing, because we've really done a large outreach campaign to them so that they're understanding that they are prescribing people into addiction, and they need to slow it down and take real account of what's happening with these opiates.
And try, I assume, to find other alternative methods of dealing with pain. That's one of the issues, isn't it?
Definitely, yeah. We'll talk about holistic. We'll talk about physical therapy. Anything that people can use to relieve pain should be an option and should be available for them to try out.
And there's meditation, and there's, well, that's probably
Yoga
part of
and-
the holistic,
yes.
what you're talking
Yep.
about. Right, right. The other problem here is in drug abuse overall, what we're seeing a lot of, in the law enforcement community, I guess is the we I'm talking about, the fact that fentanyl is laced into so many substances, and we keep hearing about fentanyl. What is it, and how would people stay away from it, and is there a real valid medical use for fentanyl? Do you know?
Fentanyl is actually it was used for anesthesia. Fentanyl is an anesthetic. Yes, and but now it's coming from all over. It's being produced in all different places and making its way it has made its way into the country, and it's less expensive, so people use that for a cheaper high. But now when it's laced in, you don't know how much is going to be in whatever you're using, and if you're not prepared with Narcan to turn around that overdose, that's where the problem comes in.
Well, I know there's been a big, the committee and everybody has made great efforts to make sure that Narcan is available and that people are aware of how to use it, right?
Correct. Yeah, Narcan, you can text for Narcan, you can do social media for Narcan. I know in Erie County, the health department offers it, and as well as in other counties throughout Western New York. So anybody should be carrying Narcan. Everybody should be carrying Narcan because it does save lives.
It absolutely does. Now, what did it take, Kate, to bring this problem to the attention of the public, which we started maybe 10 years ago,
right,
and particularly to areas like not just central areas, but not just big cities, but rural areas as well?
Yeah, rural areas are being impacted, I believe, the hardest, if not harder, than big cities. Again, because there may be less entertainment, and so people are finding their own entertainment. Don't quote me on that, but it's one maybe area of the reason. We need to do better for all of these people and for providing outlets.
There's a lot of help out there, but let's give some specific examples of what they can do and where they can go for help, Kate.
I would definitely call the helpline, 24/7 helpline. Should be your first call, whether you're suffering or whether you have a family member who's suffering. Make sure you're using the local resources that are available. So you can check out the helpline. There is the Hope Line through New York State. There's lots of local resources listed on the WNYCDC.com website. We have resources on the PRC website. There are a multitude of resources available for people to look up and find.
So I was so amazed to hear at our meeting a couple of weeks ago, the age that you feel, that the committee feels, and that people in the field think that we should make people aware how young people are that should be taught about drug abuse. It's amazing to me. What did I hear? The sixth grade or the fifth grade or the fourth grade?
Mm-hmm. And some of the programs are even earlier than that. Mm-hmm. Actually, at a meeting I was just at, someone reported that they were in the elementary school. There were third and fourth graders that had vape devices.
Oh, that's
taken
true.
away
We were
from
talking
them.
about the vaping. Mm-hmm. How old are you in the third or fourth grade?
9.
Yeah, right.
9 years old. I have a 9-year-old daughter.
About 9 years old. So this information should be taught at a really young age, is what you're saying?
Yeah, we need to be talking about it right away, because if we don't make it taboo, then it's okay to talk about with your family. You need to talk about family history with addiction. You need to talk about all of those things, because that's how you're molded as an adult. So we need to talk about it, have clear, open communication with parents and adults and children so that they're not afraid to ask the questions, so that we help lift the stigma around addiction, and we can really move forward in helping people who do suffer from substance use disorder.
We made the PSA about specifically pain, the abuse of pain medication.
Right.
That seems to be something that people are not that aware of. Like, they know the word fentanyl, for
Right.
example, but I don't know if the public is aware of how common, we just gave the statistics before about how common it is and how people get started with the pain medication, in not just from doctors, but using pain medication that may be legitimately for their parent or for somebody else in the household, and abusing it.
Right.
Actually, data that's been collected in the Western New York region from youth surveys that have been delivered in the school districts. I just took a look at that this morning. Around 50% of the youth in our region, this is 8th, 10th, and 12th graders who are surveyed. About 50% reported that they got their prescription, the medication they were using, prescription medication that they were misusing, from home. And about 25% of them say that it's from a friend or a family member for free.
So I'm thinking that the education that you're talking about has to be not just the young students themselves, but the whole family, the parents, right?
For sure.
Have to be involved in some way.
Yeah, and that's why the initial message of this campaign in 2021 and 2022 was about, I work in strictly prevention, is safe medication safety, safe use, safe storage, and safe disposal. And safe storage is a big piece of that. People have medications in their homes, locked, in their medicine cabinet or wherever you keep them now, and youth have access to that. And it can be the parents, it could be they go to their grandparents' house. Most of the prescription medications are prescribed for elderly people, but ages 18 to 25 are the age now that's mostly abusing that.
Right, even though it was prescribed
Right.
legitimately, as you might say, medically for a good reason. You mentioned storage, and you mentioned the third, disposal. That's a very important point we should make.
Absolutely. So prescription medications, if someone hasn't used the whole prescription for some reason, there's deactivation bags, which you take the medication, put in a bag with water. It mixes and deactivates the chemicals that are in that, and then that can be just thrown in the garbage. There's drop boxes throughout the counties, police stations, numerous places. That can be found on many websites, on probably the CDC website.
Yep.
It can be found on our website, and you can just take your medications there, put them in a box. It's like a mailbox. You can't have access to it. Put medications in there, and then the DEA does take-back days. April 22nd is the date for. There's the first one for this year, and then there'll be another one at the end of October. So there are safe ways to dispose of the medications so people can't reach them. You can also store them safely in locked bags or locked boxes. They make prescription bottles that have like a lid that locks right on there.
And that you can get the medication out
Even
when
if you need it.
really need it. Let's not forget that part. And open this.
Exactly, yeah.
But that's the purpose of it, to make it hard to open,
to
I'm
make it
sure.
difficult, yeah.
But not when you legitimately need it. It's very frustrating. They announce, tell the media, about where these drop-off boxes are and when these days are, right?
Yes.
So, I mean, I know Matt's always talking at the meetings about how the drop-off boxes, and people are not really aware of them. And people probably don't think until we tell them today about disposing of the medication when they're done with it. They probably just leave it in their medicine cabinet, and that's how it gets abused, right? By some family member or somebody visiting.
And you can take even over-the-counter medications to a drop box. There's no questions asked. If you have expired cough medicine, you should take it there. You just drop it in the box and it's done with. Never flush it, never dump it down the sink, never just throw it in the garbage can. Make sure you're disposing of it properly.
Ooh, really?
Yes.
Never flush it?
Never flush it.
I bet that's what people do.
That's what people used to do, and studies were found
It
that
seems like the easiest way.
it does,
you know.
yeah. And you think you're keeping the kids
I'm done
safe
with this.
or others safe, but then it's getting in the drinking water.
Right. It
And then
impacts
it's polluting the
water
waters
system.
and our ecosystem. So
Oh, well, that's
again, unintended consequences.
yeah, a lot of the things we're talking about, even adults' unintended consequences, not thinking, oh, somebody might use this, misuse this
Correct.
after I've done with it legitimately. Well, maybe we should one more time tell people how they could find out more either online or social media.
Correct. So we have the Hope, Erie County Hope Project is on Facebook. We have the WNYCDC.com website. We have the WNYPRC.com website. There's the WNYUnited.org website.
Yeah.
So.
You can just go to Kate. She has all of them memorized.
Or just call me.
Why don't we just give you your cell phone? No, we're not going to do that.
No.
All right, okay. But there's a lot of help available and a lot of information available, and we just can't talk about it enough. So thank you so much. Thank you, Dawn Sagerman from the Western New York Prevention Resource Center, and Kate Chudoba from the Western New York United Erie County Opiate Task Force. WBBZ is proud to support your work to help everyone in Western New York. We'll be right back.
Thanks to Judge Penny and our guests. Remember, talk to your healthcare provider about prescription medications and ask questions. Do I need this medication? Is a non-opioid or alternative treatment available? How long will I take the medication? When will I know to stop? What are the side effects? And will it impact other medications I am taking? Please remember, safe use, safe storage, safe disposal. More information can be found at Western New York Prevention Resource Center at this website, WNYPRC.com. Hope Chautauqua Coalition on Facebook. The Western New York Chemical Dependency Consortium at this website, WNYCDC.com. And the Erie County Opiate Task Force can be found at www.3.erie.gov. The public service announcement was funded by the New York State Office of Addiction Services and Supports, OASAS, through a New York State opioid response grant.